Hi everybody and welcome to this video lesson. It is on English for hospital. Remember I told you about ESP, that is English for specific purpose. So this is the second video on this in this series. So I'm your host Israr Ahmed Khan, and I welcome you all to this video. So here we go. Hospital staff. Hospital staff comprises doctors, nurses. You want to know the details? Okay. We have senior consultants, specialists, doctors who see patients at specific times. Then we have registrars, senior doctors who supervise residents, interns, and students. Then we have residents who look after patients on the ward and are in training for specialization. Then we have interns who have completed their studies and are now finishing their final year in hospital. And finally, we have student doctors who are undergraduate medical students. Then we have nursing staff, nurse unit manager runs the ward, associate nurse unit manager helps the nurse unit manager to run the ward and acts as the manager when the nurse unit manager is off site. Then we have nurse practitioners who are highly skilled nurses with an advanced level of training. Then we have specialist nurses who are clinical nurses. I mean, they include clinical nurses, nurse specialists, clinical nurse consultants, clinical nurse educators, triage nurses, and emergency department nurses. Then we have registered nurses who provide a high level of day-to-day care and perform some minor procedures. Then we have enrolled nurses who provide basic medical care under the supervision of more senior nurses. Then we have allied doctors staff who are who have specialized in different things like dietitians, occupational therapists we have, then pharmacists we have, then we have physiotherapists, then we have podiatrists, then speech pathologists. Other than these, we have clinical assistants who take care of ward housekeeping. Then we have patient services assistants who bring meals and drinks. Then we have porters who take care of patients lifting and transport, volunteers who help with fundraising and ward visits. Then we have ward clerks, staff the ward reception desks. So these are the people that you can find. Now, since we are talking about hospitals, we must know that there are these major organs that generally, people go to hospital to get some treatment for either one of these or maybe more than one at times. So have a look at this. Brains, brain controls center of the body. Heart pumps blood around the body. Stomach helps in the breakage of food. Then intestine helps in the digestion of food. Similarly, we have lungs that help us to breathe, liver that cleans the blood, and finally, kidneys that help filter the waste material out of the body. Then we have other things also which we see in a hospital. We see capsules, tablets, droppers, syrup, IV injection, intravenous injection. Then we have gel capsules, suppository, inhaler, ointment, and medicine bottles. These are all related to a hospital. Then we have some material that is used there, like we use basins, we use IV pole, we use hospital beds. There we have examination table also. Then we have MRI device, and then defibrillator, for heart patients. Uh, this is a continuation of the previous one. We have bakers, stretchers. We can see ECG monitors. We can see disinfectants, and we can also see ambulances in a hospital. Then these are the things that you are likely to see. These are the actions. For example, uh, they take blood pressure, they listen to lungs, they check eyes, they check ears, they start an IV, they look at an MRI scan, doctors explain some things to them, to the patients, and then they give shots also. Similarly, they prepare for surgery, they take pulse, they operate, they take the patient to maybe operation theater. They write everything down in the chart, they bandage, and you pay the bill. Okay, guys. So thanks for watching this video. I hope you liked it, and keep watching my videos, and don't forget to subscribe my channel and press the bell icon button. Thank you so much, and see you in the next video. Bye bye. Take care.